Hello, I'm Dr. Adriana Potter, and on the video today we're gonna go over a series of positions to help you with relaxation for the pelvic girdle. This video can be very helpful for patients that are recovering from post-surgical pain on the abdominal or the pelvic area, from hysterectomy, endometriosis removal, or just plain pelvic pain, increased pelvic muscle tone, or cramping from your menstrual cycle. This can help you to help manage that pain a little bit that you're having ongoing or cyclic. You will need for this video yoga blocks or a bunch of pillows. I have both of them, and I'm going to demonstrate how to use them for your relaxation. I also recommend that you use a nice hot pack, which can be quite relaxing. I love a my circle pillow. If you don't have anything like this, you can use a yoga mat or a bunch of towels rolled up to help you to open up the chest a little bit, and of course a little bit of cervical support. And you can make do with things that you have around the house, so you don't have to buy it. Okay. For the first part, we're gonna go into the pelvic relaxation position, and I like setting up in this way. Okay. When you go into that butterfly stretch, you want to make sure that you're using a lot of support so you don't feel stretching in your inner groin. So here you can use the yoga blocks, and you kind of play with a little bit of the height of it. And I like this position for my spine, and it varies from person to person. Okay, whatever you want to do it, and you just go into this relaxed position. The pillows, I like setting up with my arms into this position and feeling no stretch. And I have my hot pack here, which you can put right over your abdomen area. If you're having pelvic pain, you can go down towards the crotch as well, and with everything kind of nice and supported. And you put a nice relaxing music on the background. Put your hand over the small of your abdomen, right above your belly button, and start paying attention to your breathing. Breathing in on the count of 1, 2, 3, 4, and you're breathing out on the count of 1, 2, to the rising and lowering of your belly, the upper chest is not moving. If you see this going up, that's not right. Only the bottom hands should be moving, only when you're doing a quiet diaphragmatic breathing. Just relax. Pay attention to any tension that you may be holding on. Feeling the heat of the hot pack, the support of the pillows, moving your neck side to side. Make sure your shoulders are nice and relaxed, letting go all the tension. Not feeling anything stressed or stretched. Focusing your mind where your pain is. And if you're feeling any muscle tension, try to let that go. Breathe in and out. Feeling Feeling that relaxation coming in. Releasing your mind to be in the moment. Redirecting your thoughts to good things in life, to things that serves you best. Now is not the time to think about anything else other than just being in there. Feeling your breath in and out. Trying to make each time longer. In and longer out. If you have pelvic tension, you can try to do a gentle kegel, which you feel the curved end of the tailbone, and let it go. Focusing on letting it go. Focusing on the dropping of that muscle when you let go. And if you're not sure, if you let it go, you can do a gentle bearing down and relaxing. And when you bear down, you should feel that the tailbone come down towards your feet. And let it go. If you happen to feel your muscles coming up towards your face, your tailbone coming up or inwards, that is actually a contraction. And you want to do exactly the opposite. It's moving it downwards, like opening a flower. And you breathe in and out. And focus on the moment. Enjoying just being there. And your objective is to be there for about 5 minutes. And if you want to be here for longer, I would suggest you to pause the video now. Pause it if you're ready to move on to the next part. If you're ready to move on, you're going to start wiggling your body and your pelvis and back. Bring your knees towards the middle and move that backpack, that hot pack in there. And move your knees. Move your blocks to the side. And rock your knees right and left. Feeling for that softness that came in from relaxing in that pelvic relaxation position. And you can keep this swinging for as long as it feels good. Looking for everything to feel good and better than what it was before. Leaning one knee to the chest. Making small circles with the knee. And then reverse the direction. Feeling the hip starting to warm up a little bit. And you're going to let it go with the knee and grab the other one. And start with those small circles. Small and big, whatever feels good. It's just a suggestion. And then reverse the circle. And you can grab the other knee to chest and you have both of them rocking right and left. softness that comes from the small of your back. The right knee is going to come down and the foot's going to touch the ground, and the right foot's going to come across. And you're trying to open that left hip into that piriformis. If you feel a lot of stretch in this position, perhaps that's where you're going to be. But if you don't feel much of stretch and you want to move on to the next level, you will slide the leg towards your chest and hold on the back of it and feel that piriformis opening in that position. Your diaphragmatic breathing is ongoing. If you know Ujjayi breathing, which is more controlled breathing, is more like an ocean sounds on the breathe out through your nose with your mouth closed. You breathe in through your nose and you breathe out through your nose. That soft sound on the back of your throat. And you're looking for this stretch to be there for about a minute. Noticing the tension, where is that, and noticing that it kind of changes for better. It becomes softer, supple, and not so tense. If you're not feeling any stretch, perhaps you're gonna use your hands to bring that foot more towards your chest, and you cradle your other hand towards your knee, and you bring that towards your chest, and you rock right and left. No discomfort, just relaxing. Focusing on your breathing, and after a minute or so, you're gonna let it go. Bring the windshield wipe motions into the hip, rocking right and left within no painful range. And then you're gonna move on to the other side, crossing over. Diaphragmatic breathing or Ujjayi breathing. You keep the level that you want as long as you're feeling some stretching on the gluteal region. Even if you're ready to move on to the next level, you hug your knee behind you. You rock side to side, just sweet it out like it's a baby. Letting your body feel the softness. Bring in and out. Stay to the level that it feels best for you. It varies from person to person. These are just suggestions to either increase the stretch, but always promote softness and relaxation. If any pain comes along, it's not working for you, go back to the previous step. But you're looking for staying nice and relaxed in this position. Allow a minute. Go back with the feet down on the ground. And go to your rockings, windshield wide motions on your hips. Anything that feels good. If you have any support on the back, go ahead and move the support to the side. And also the neck support. And go completely flat. One leg is going to go long and the other one is going to come across. And you're going to lengthen the leg to the side. And doing a gentle spine twist. The shoulder should stay flat. And you're feeling maybe a little pulling, but no pain. Breathing in and out. Allowing your body to relax. If you need more support for your knee, bring supports in there and allow the relaxation to take place. Breathing in and out. Relaxing. Anywhere that you feel like you might be dancing out. One more time, breathe in and breathe out. And bring your knees to the center one more time. Bend your knees, rock right and left. Move on to the spine twist to the other side. Using your supports to promote that relaxation. Bottom leg's lengthening, right, the top leg bending, twisting into the hip, feeling the stretch over your hip. Then relax your head. Keep your shoulders down. Breathing in and out. Inhale and exhale. Inhale and exhale. Making each breath longer than the previous one. If you're ready to move on, bring back to the center. Rock your knees side to side. And switch yourself completely to one side. Take a deep breath in there. Little pause. Inhale. And exhale. We're just transitioning to go into quadruped position, tabletop. And completely twisting and moving yourself into hands and knees. If your wrist bothers you, you can grab your blocks and go into your elbows, or stay in your hands. And you go into a cat, lift it up, breathing in, and breathe out. Let go all the tension in the pelvic area. Breathe in, breathe out, drop all the back, relax the muscles of the pelvis. Breathe in, is a variation, but this is the position, head to the side or down. If you need more support, you can get supports behind your knees to keep your hips up. Then you're feeling that belly in here, rising and going inward when you breathe out. Arms extended, and if you doesn't feel comfortable, you can put pillows and do a supported child pose. This is absolutely awesome when you're pregnant because it kind of creates a little gap for your belly here, but it feels good in any phase of your life. Inhale and exhale. Noticing the tension anywhere. Let go of the tension. Just breathing in and out. Creating softness and relaxation. Inhale and exhale. One more time. Inhale and exhale. Be here just like in the first pose we did for 5 minutes. You may switch your neck around, you may move it forward, sometimes putting a little support with the block to your forehead. It's quite comforting to the whole upper body. It just relaxes everything. If you want to stay here, now is the time to pause one more time in your video and appreciate the position for what it gives you, allowing the relaxation in there. And if you want to move on to the next one, transition to sitting position. So put your hands to the side and press into that quadruped position. Using any movement that feels good. And at any time you need to stay any longer on any other positions that this video suggests, you're welcome to. Move to a seated position. Mermaid is a good position for a lot of people, but some are not as open on the hip to do it. So we're gonna go into a crisscross. And if this feels too much uncomfortable into your hip area and you're not being able to relax, that's when your props come in hand. Whether you use pillow or the blocks, and you just sit in there. Feeling for what has changed, bringing some circles, the pelvic dance into this position. Breathing in and out. One more time. Inhale and exhale. Next time you inhale, make it long. Breathe in a little bit more. And exhale. All the way. And go nice and tall. Breathe in. Arch the back like you're doing the cat and cow. Look up a little bit. Breathe in all the way. A little bit more. And let it go and round. One more time. Breathe in. Let go of all the tension. So with pillows or blocks, right hand go across your hip, left hand behind you, and you do a little gentle twist towards that side, breathing in and out, feeling any tension in the head, and just gentle jiggles to try to release that tension. And focusing on your breathing, focusing on being in the moment. Inhale, exhale. Inhale again, exhale, release the position. Roll in your shoulders, let it go, the air. Inhale, left hand comes across the opposite knee, the other hand behind you, trying to twist. Exhale, and a twist. Inhale, exhale. Add any movement that feels good to let go any tension that doesn't serve you. Inhale, make it long and deep. Exhale, let it go. One more time. Inhale, exhale. Last time. Inhale and exhale and untwist. If you're ready to make your stretch a little bit more intense into your hips, let your hands walk forward over blocks or just pillows, trying to keep the back tall and you're hinging forward from your hips versus rounding into that cat. Nice and tall, hinging forward. And you breathe in and out. One more time, breathe in and out. And third time, breathe in, breathe out. Let your head hang. Inhale. Look forward. Exhale. Relax forward. Inhale. Look forward. Exhale. Round forward. Last time. Inhale. And exhale. Allowing a forward fold for whatever it is for you. Keeping your eyes closed or open. Allowing your body just to relax. Breathe in and come up. And you probably felt the stretch more intense on the side that the leg is forward. Now we're gonna move the opposite leg forward. You're gonna repeat the same relaxation here. Your awareness is gonna come now to your hip, which the foot is forward, in my case, my right side. Whatever side is it that you're stretching and you're feeling the intensity. Some people feel both equally because they are very restricted. And you're gonna breathe in, hinge forward from your hips. And if you're ready to do more intense stretch, you may allow that forward fold to increase. Breathe in and round down as you breathe it out. Breathe in and stay as you are if that's where it feels best for you. Move forward only if that's what you're seeking. As long as you feel like you're able to relax. Breathe in and let go. Breathe in and let go. One more time. Breathe in and let go. Last, breathing in, look up. And breathe out and round it down. Breathe in and come up off the stretch. Edit the rocking side to side, pelvic dance, keeping your eyes closed or not. Alright, hopefully you like the video. It's a gentle relaxation for the pelvic area. And if you feel like you need to relax a little bit more, I would suggest you go into the relaxed awareness for the pelvic area, which I'm going to demonstrate one more time for you. And you can use your props any way you want it, as long as you're feeling the relaxation and you're not feeling a lot of stretch. I'm setting up the way I like most. That's my supported Shavasana, my favorite way to relax my muscles. And a leg crisscross or a butterfly stretch. Butterfly stretch, your feet are close together. Crisscross, you're feeling a little bit less stretch, less opening. Whatever it is for you. And using your pillows to keep the support so you're not feeling the stretch, you're feeling the opening. And you're gonna finish the relaxation for another 2-3 minutes or longer if that's what you're looking for. I'm gonna put my blocks on the side of my elbows to allow more relaxation into my arms. Feel the breathing in and out. And if you need more guidance, place one hand on the heart, one hand on the belly. Feeling that bottom hand rising and lowering. And the top hand, not much movement is happening. And relax your arms. the relaxation there. You stay here for as long as you need to. And if you wish to stay longer, you may pause the video one more time and relax for a little bit longer in there. But if you're ready to move on, you're going to close your legs and swing to the side. This is a good position to relax a little bit more with pillows between your knees, a pillow behind. Not completely on your hip, but slightly 3/4. Opening the chest so your shoulders are not stacked like this. They open to the side behind that pillow, behind your back. Ready to move on. Breathe in. And as you breathe out, push yourself to sitting. Take a deep breath in that seated position. And let go. Hopefully, this was very relaxing. And you're feeling less tension in everywhere on your body. And you're feeling the calmness and peacefulness inside of you. My name is Dr. Adriana Potter. And on Let's Get Physical today, we did a series of movements for relaxation of the pelvic girdle, the spine, and hips and pelvic floor. And don't forget to subscribe and press the bell button to get more information on the future videos. Thank you for watching.